Thanks for staying tuned. Welcome back to our COVID-19 update. When it comes to COVID-19, all age groups are at risk of contracting the virus, but older people are especially vulnerable. Research has shown that adults 60 and older, especially those with pre-existing medical conditions, face significant risk of developing severe illness. So how can the elderly be better protected? A public health physician, Dr. Maureen Samuel, is here to share her insights. Good evening and thank you for your time.
Good evening, thank you.
We tend to ignore the elderly when we're talking. We talk about everybody else except the elderly. And yet, in this case, they are the most vulnerable. What can you say about how they are fared so far in the last 2 months or so that we have been actively battling COVID-19?
Yeah, talking about 2 months ago, we noticed that globally speaking now, the Israeli doctors, as well as the Cuban doctors, went to assist their counterparts in Spain, Italy. And because the cases in Italy was rising very rapidly, and they needed to help them. And there was this social media message that came out, and the Israeli doctors were advising that people should stay back at home. And they made a profound, shocking news, which actually I was shocked at, that elderly who were 60 years and above were not being attended to because every medical intervention they gave was not yielding any positive outcome. Now, bringing it back home, according to the National Population Commission, we have about 9.3 million elders. That's those who are 60 years and above. And so this is a significant number in our population. We need to protect them. The elderly need to be protected because they are vulnerable. Protection will come in the sense that, well, they are vulnerable because we notice medically that their adaptive as well as their innate responses towards fighting against infections are actually optimal compared to children, compared to young adults. And this usually favors the COVID-19 virus so that it replicates rapidly and aggressively and pushes this virus down to the lower respiratory tract. And those who have such symptoms, who have exposures to the virus replicating massively in the lower respiratory tract, are those who come down with the moderate and severe form of the infection. So one of the ways we can protect these elders is continue with keeping safe. They should wash their hands with running tap and water and soap. They should, if that is not available, should use alcohol-based hand sanitizers. They should avoid touching their faces. Yes, they should use face masks if they have to go out to the public. And they should avoid contact with anyone who is ill at the moment. We know that these adults also come with some comorbidities. And so most of them, those comorbidities could be in form of heart diseases, in form of renal diseases, hypertension, diabetes. And so they are actually on some medication.
Already? That is even before COVID?
Yes. And, you know, when they are already on these medications, their immune system is also reduced at this state. This makes them more vulnerable, apart from their innate and adaptive immune responses too.
Right.
Yeah, so these also elders, we also need to, we go for visits. So one of the other ways which we can protect them, apart from keeping safe, which I've also mentioned, is that they should avoid unnecessary clinic visits. So their doctors should give them at least some quantity of drugs that can last them for a while. And then if they have cases where they are booked surgeries, which we call elective surgeries, they should be postponed. Yeah, and at this point is now we should now encourage telemedicine, where they can have consultation virtually, either through telephone calls or through online services. So these are the measures in which we can use to protect elders. Like the NCDC DG also mentioned, physical distancing should be practiced at this moment. The elders are prone to depression, so they shouldn't be socially isolated.
Because that was going to be my question, that how do you distance yourself from someone who is your loved one, like a grandparent or a parent and so on, while at the same time expected to show them some level of love? Isn't that contradictory?
Yes, he mentioned that some of our elders are in the village, so we should not go home. It's to help them, to protect them. But some of our elders are living in with us. So how do we protect them at this junction? One of the ways is that we all go out to work. Yeah, NCDC report of yesterday, 20th of May, 2020, states that the age group most affected are 31 to 40 years. These are the active age group who are going out to work and fend for themselves. And they have a grandma or grandpa living in with them. So they also are to avoid, to carry out these safety measures. Wash their hands, use hand sanitizers, use face masks when they're going out, because they know they have a susceptible host back home. So,
but I'm sorry to cut in, but how do you let that elderly person know that basically this is in your interest? Because given our own cultural context, I mean, we're all around parents at various seasons and so on, and then all of a sudden you start saying, Mama, you've got to stay over there and so on. You know, wouldn't that bring about accusations of, am I now
Mama,
ill and
yes.
so on? I mean, these are some of the difficulties that people have already encountered.
Yeah. Mama should be educated, should be enlightened. Mama, you know, this is not how we treat you, but henceforth, to protect you, because of your immune status, is not as strong as these young children, your grandchildren. So they should be encouraged in the sense that they can do video calls with their grandchildren. They can do video calls with their relatives, with their children. So that will minimize them going out.
Or those people having to come to them.
Or those people having to come to them. Also, they should be given access to areas of worship, so they can log in online, so they can have worship services going on for them. That will give them some support, spiritual support, that will help this elderly.
Now, in terms of medications and treatment itself, I mean, if, as you pointed out, someone with an existing condition then has COVID-19, you got to treat the COVID-19 and continue to treat the existing condition that COVID met. How safe is that, do you think? I mean, as a physician, how safe is it to do 2 treatments on such an elderly person? I'm just wondering. This is a question that plenty of people have asked me, and I say I'm not a doctor.
Yes. They have to take both treatments, because one, treating their comorbidities will help to improve their health immune status. And that will also help to fight, for them to have some immunity to fight against the virus itself. So they have to keep a balance. They have to receive their treatment, their hypertensive drugs if they're hypertensive, or their diabetic drug if they are diabetics, you know, so that they can be at optimal health status to be able to fight the COVID infection, since we don't have a clear-cut treatment for COVID.
Going forward, and in just a minute, what advice, I mean, briefly, what would be your takeaway for the elderly who is listening to you?
My takeaway to the elderly is that they shouldn't be afraid. Yes, they shouldn't be afraid. They should carry out these measures. They should know that these measures, as in social distancing and physical distancing from their young ones, whom they love and want to hug and relate with, it's for their own good, and keep safe.
Thank you very much, Dr. Maureen Samuel. It's been a pleasure having you with us. And I hope the elderly do listen to you and those who are with them. Thanks so much for your time.
Thank you.